Entertaining and food for thought and interesting views. I think we should go back to the phases of the moon for deciding who's on the council at work just as well. The Aotearoa COVID action potential public health risks associated with the World Kayak Games. Well, there you are. This will be interesting. Welcome, Julia Schiller. You have 5 minutes from now.
Kia ora, Mayor Brown and Auckland councillors. I appreciate the opportunity to speak with you today. My name is Julia Schiller, and I am here on behalf of Aotearoa COVID Action, couvidaction.nz. We are a volunteer advocacy group of hundreds of New Zealanders, which includes doctors, health experts, educators, business leaders, and parents. We are united in our dismay that despite a world-beating initial COVID response, our country no longer has a credible plan to keep our people safe from COVID. Instead, far too many of us, from average citizens to our media, to our medical, business, and political leaders, seem resigned to living with COVID. From overseas examples, countries that are further along that sad trajectory than we are, it is increasingly clear that living with COVID equates to accepting that a level 2 biohazard is free to circulate virtually unchecked, gradually, but sometimes dramatically, debilitating the lives and livelihoods of more and more of us. We cannot accept this outcome for our country, and so I find myself here in what is actually an incredibly absurd position to try to raise some warning bells about a series of upcoming co-council sponsored events that tick every known box for being super spreaders. The World Choir Games will unite thousands, 11,000, long-haul travelers to sing in groups at dozens of different large indoor venues over 10 days at the height of our winter illness season. Yes, the organizers have belatedly made some vague reassurances about ventilation and a few other measures, but we feel these will not be adequate to significantly reduce the transmission of illnesses. I appreciate the council is only one of many sponsors and that most of the events are not taking place in council-owned facilities. However, of all the entities involved with the Games, it is council who has a duty of care to all of Auckland's citizens. The size and scale of the World Choir Games are unprecedented since the beginning of the pandemic. And so they absolutely have the potential to cause unprecedented suffering for individuals not only across Auckland, but our whole country, as well as incredible strain on healthcare, mass transit, and other institutions on which people rely. The Games kick off in just under 2 weeks, which restricts what you may be able to do. However, I would like to call your attention to a statement on the Te Whatu Ora website, which empowers you to impose mask mandates on participants, staff, and audiences at the World Choir Games events to be held in council facilities. The statement reads, "Some places, such as workplaces, special events, and marae, may still ask you to wear a face mask as a condition of entry." The Choir Games say they will have a supply of masks at all venues. Hopefully these are good quality N95s. In either event, this will make it easy for people to take this simple and highly effective precaution. A policy of only encouraging or welcoming masking has resulted in only a small percentage of people taking personal responsibility by one-way masking. And we have seen this has not been enough to prevent previous waves, nor our current 6th wave of COVID. So it would certainly not be enough to limit the inevitable damage in the wake of the super spreading World Choir Games events. I encourage you, please, set an example. Mandate masking at Choir Games events held in council facilities. and exert moral persuasion on the other choir games events to follow this example. Thank you very much.
Thank you very much. Doesn't seem unreasonable. You give them an excuse for not going anyhow. Are there any questions about this? I heard the Chief Executive coughing beside me, so there's a worry. Righto, limited questions are coming from Councillor Walker and Councillor Turner. And the Deputy Mayor might want to say something or not. No, she doesn't.
I don't have a familiarity with all of the venues, but I imagine that there are a number of them, particularly with that many people. What are some of the things that could occur at those venues and other locations that might help to reduce the spread? Obviously, there's masks, there's ventilation.
You'd all hum, I suppose.
So we had a few other ideas. Yes, ventilation is obviously crucially important, but it may not be enough in a large facility with a lot of people engaged in singing, which we know produces an extraordinary amount of aerosols, which are the tiny, tiny particles that can spread the virus. You can install CO2 monitors, which give us a rough idea of how fresh the air is and what percentage of it is likely to be loaded with other people's emissions, as it were. And you could have a policy of evacuating and clearing the air if the CO2 levels rise to a certain degree. So I don't know if that's in place at these venues. That is something that could be done. I think it would be sensible if the participants of these events were rat testing frequently. A lot of them are going to be arriving on long-haul flights. We know that that can also be a very dangerous environment for spreading illness. So screening with rat tests, probably when they arrive in country and then every few days would be sensible, and staying away if they have any symptoms or a positive result. It is possible to test positive and be able to spread the virus without having symptoms. Other steps, I mean, this gets maybe more complicated and expensive. I wondered about fever screening as people arrive, because that is a symptom of not just COVID, but other contagious illnesses. People might not be aware if they're running a low-grade fever. But obviously, yeah, that's more costly and probably too hard to implement at this stage. Yeah.
Thank you for that answer.
A quick follow-up question, very quick. So I'm assuming that a number of the venues are Auckland Council venues.
Some. I know there's going to be some singing at the town hall.
Sure.
I'm not sure if the Botanic Gardens counts, but that's the one outdoor facility, which will be a little bit safer, although with that many people, it can still be presented a hazard.
Okay, you may have something in what you're saying. I was one of 44,000 people at Eden Park who shouted and screamed, and I got flu on Tuesday. There you go. Councillor Turner, Councillor Bartley, Councillor Henderson, and then we go on with the rest of the day. Thank you very much.
Thank you. My daughter and my son-in-law are ambulance paramedics. My son-in-law is a flight paramedic. He also has a PhD in some sort of paramedic health science. He also was participant in a mask study because he has a beard at the Auckland hospital. I'm sure I can get the information, but he tells me that was conclusive that the mask made no difference. What do you answer to that?
Well, actually, we've also had very recently a large international study in which our Professor Michael Baker of Otago University, public health expert, participated, which demonstrated that masks are incredibly effective. I would encourage you to, I found these videos the other day. The University of New South Wales 3 years ago made some videos of a gentleman speaking, singing, coughing, sneezing, and captured the particles that are emitted. They also showed what it looks like if you're wearing nothing, if you're wearing a one-layer cloth mask, a two-layer cloth mask, or what we call the baggy blue, which is the surgical mask, which we know isn't terribly effective, but even it blocks a significant amount of the particles, aerosols, etc.
So we disagree. Thank you.
There's a lot of evidence that masks work.
Thank you. Councillor Bartley.
Thank you, Your Worship. Thank you, Julia, for coming in today and for raising this, because we have become complacent as a society regarding COVID. My question to you is, in regards to the event that you're raising, is it because it is international? Because we've got lots of other events happening in enclosed spaces. I mean, Matariki's coming up as well.
Sure, sure. As I said in the comments, to me, it is unprecedented because the event will be, they're anticipating 11,000 participants. The bulk of these are coming from abroad. Many will arrive on long-haul flights, which are particularly dangerous. You know, a hop over to Australia is much less dangerous than a flight from North America or Europe. Also, these people are going to be sort of combining and recombining at all these different venues over 10 days. So it's not at all like a one-off concert or, you know, Eden Park going to a sporting event. This is, you know, people potentially spreading quite a lot of illness amongst themselves over 10 days. And of course, it won't be contained to the participants and the audiences at these events. I mean, they're visitors to our city. They'll be taking mass transit. They'll be eating in restaurants. They might decide, since they've made the trip, to see more of our beautiful country.
Councillor Henderson, please.
Thanks, Mr. Mayor, and thank you so much for your advocacy and public health initiatives. It's really appreciated. Just got a question around Aotearoa COVID action and the activities that they get up to. We got some great advocacy within my ward, I know, around people that have long COVID. I'm just wondering if you work with long COVID sufferers and what are your concerns about that as a risk?
Oh, yes. Of course, that's a whole separate issue, but I don't know how many people are aware that on average, with your third COVID infection, your risk of long COVID is about 40%. And of course, it rises from there. That's why I said we're not as far along the trajectory that we see evolving in other places, such as the UK and the US. Some of their citizens have had this illness 3, 4, 5, 10 times. And, you know, even here, we're starting to see these numbers of people with long COVID. Those numbers are mounting. And I've been told that it's worse than undergoing chemotherapy for cancer to have long COVID. And that is, you know, I guess the most well-known consequence of COVID. But I'm not sure if you're aware, some people say that it's just a cold or it's just an upper respiratory tract infection. And in fact, the experts are classifying it as a cardiovascular illness. And we are seeing, and it's only you know, statistics that will bear this out and not individual stories, but we are seeing people who are far too young experiencing these sort of sequelae, I think is the medical term. I mean, I have a 42-year-old friend who just had to get a pacemaker. He's had COVID twice. You wonder.
Thank you very much for that. I think we'll take some thought about that, whether we encourage, I don't know if we've got the ability to tell people to wear those, but
You might.
perhaps we could try and encourage the hymn singers to hum a bit. Well, very practical solution, that, you know. Thank you very much for that. I would move that we receive the public input from Julia Schiller on behalf of COVID
I'm happy to second
action.
it.
Someone was happy to second that.
I am over here. And please, Julia, don't take the laughing as anything to do with your presentation. The laughing is just in response to the crack that the mayor made.
No, well, I was just making sure that everyone is aware of it.
Yeah.
And I think that you are raising some very valid points. And I think we should actually encourage people to wear masks that it doesn't preclude actually having a little bit of humour, you know. Sometimes humour works quite well, getting
But
things
it's
across.
serious.
Nevertheless,
Yeah.
I'm going to put that, and thank you for seconding it. All those in favour, please say aye. Aye. Contrary. That carried, and thank you for attending.
Thank you.
Are there any extraordinary items?
Yes, there is.
Oh, sorry, the local board input. Nobody's bothered with local input. Now, are there any extraordinary items?
Yes, there is. I have an extraordinary item, please, Mayor. Following on from Councillor Fletcher when she raised the issue of Smith and Cowie, I'd like to raise the issue of food poverty. Given the 1 July deadline that City Mission is facing with the cuts to their funding from the government, that leaves about 25,000 Aucklanders without access to food. That's our constituents, our public, our people, not only from the City Mission, but also from the places like Vinnie's that have 17,000 on their books, they're taking a cut. Places like Village Trust in West Auckland has 8,000 on its books, and it's only going to be able to give food parcels to 200 families. Places like our local organisations that do food banks, they get their food from City Mission. So that's 50 organisations in our own communities that won't be able to deliver any food parcels to their communities through that Food Link program that City Mission runs. Marae also get their food from City Mission. So I wanted to raise it here because that is a lot of people in our area that we represent that will not be able to access food. And my ask is for us as the people that run this city, our council, to, you know, what are we going to do about it? What support can council provide to our food banks, our major food banks like City Mission, like Vinnie's, like Village Trust, in regards to this crisis that our people are going to face?
Okay, well, I'll accept that, and I'll refer that to item 19 later in the day when we consider extraordinary items, and I'll give the chance for the those who are unaware if this is going to pop up to think about it. I'll ask management to give it some thought. So later in the day, in item 19, we will come back and give that a bit of thought. Is that all right?
Yes,
thank you very much for that. No, we're not feeling too far behind. We've got to keep on track. Item 7 is keeping up with what we've done and what we haven't. I'll move that, and it'll be seconded by somebody or other. Deputy Mayor, thank you very much for that. And the papers are in front of you. It's basically a list of what we've done. Is there any debate or discussions or questions on that? If not, I'll put that to be received. All those in favour, please say aye. Contrary, carried. Thank you very much. Now, item number 8, which is the monthly stuff from the Chief Executive.